Hello from the Windy City,
Chi-town,
Chicago. I am Dr. Jess.
And I'm Dr. Jen, and this is Catching Up with Vet Candy.
Let's catch up with the latest veterinary news.
This show is brought to you by Movora. Learn more at movora.com.
Anyone who's ever had a dog knows how different one can be from the other. For example, they can be reserved or friendly, playful or calm, fearful or bold, and prone to bark or fetch or not. Research has shown that some of these differences are genetically determined, but even within dog breeds where line breeding and artificial selection have led to the loss of much of the original genetic variation, the behavior of individuals can differ widely. Now, researchers show that part of the difference in temperament, in particular their energy level and fear-related behaviors, depend on acquired differences in the epigenome. Research has shown that some of these differences are genetically determined, but even within dog breeds where line breeding and artificial selection have led to the loss of much of the original genetic variation, the behavior of individuals can differ widely. Now, researchers show that part of the differences in temperament, in particular their energy level and fear-related behaviors, depend on acquired differences in the epigenome. Because the epigenome is known to depend on age, diet, exercise, training, socialization, and other environmental factors, it can impact the activity and wiring of nerve cells and thus alter behavior. Researchers at the University of California at Los Angeles quantified the epigenetic, genetic, and behavioral differences between 46 female and male dogs from 31 different breeds, with an age between 1 and 16 years. Behavioral differences were quantified based on how the owners rated their dog in the Canine Behavioral and Research Assessment Questionnaire, a widely used standardized tool that consists of 101 questions. The results showed that the epigenome was a better predictor of behavior than the genotype at the sites they measured. Even within the most represented breed are Australian Shepherds with 12 dogs in the sample, only 2 of the 930 selected single locus polymorphisms examined were strongly associated with behavioral traits. Differences in DNA methylation between dogs explained a far greater proportion of observed variation in energy, attention-seeking, non-social fear, and stranger-directed fear than genetic differences did. These results imply that the epigenome helps to shape behavioral differences in dogs, even in tissues that aren't part of the nervous system. And now, something fun.
Hello there. I am Dr. Thomas Infernuso, board-certified veterinary surgeon and owner of the Animal Surgical Center in Long Island, New York. And today I want to delve into a groundbreaking procedure that could redefine the way we care for our four-legged patients. Total hip replacement is not just a treatment option. It's the pinnacle of care for pets struggling with severe hip dysplasia, osteoarthritis, congenital disorders, or any other hip-related challenges. Today, I'm here to shed light on why embracing this procedure can revolutionize the way we enhance our patients' quality of life. To begin with, let's understand that THR transcends the boundaries of age, is a beacon of hope for pets in all ages of life. Whether it's hip dysplasia, osteoarthritis, congenital disorders, or any other joint ailment limiting our patients' comfort and mobility, THR could hold the key to unlocking a broader future. And it's not just for senior pets. The degenerative bony remodeling changes and soft tissue adaptations that occur in young dogs with severe dysplasia can be dramatic. Earlier surgical intervention may be indicated versus waiting until the patient is older. A THR procedure can be performed as early as 7 months of age. Most commonly, we see the THR procedure being applied to young dogs, 9 to 12 months of age, with severe dysplasia disease, and young to middle-aged adults with significant osteoarthritis. During a THR procedure, the damaged joint structures are replaced with an artificial cup, femoral stem, and femoral head implants, specific to the need of the patient. The acetabular cartilage is removed, and the new acetabular cup is positioned into the acetabular bone. The patient's femoral head is removed, the femoral canal is prepared, and a metal femoral stem is inserted into the canal. A specifically sized femoral head is then added to the stem to complete the joint reduction. Cemented and cementless acetabular and femoral implants are used, depending upon surgeon training and skill and patient factors. Picture a world where our patients can run, jump, and play without pain or discomfort, a world THR makes possible. THR is not just superior to medical management, it's a paradigm shift. Medical therapies are aimed at reducing the symptoms of joint pain, but do not address the underlying disease. Over time, osteoarthritis is expected to be progressive, resulting in a loss of joint function, reduced patient mobility, and worsening discomfort. It requires the pet parent to comply with lifelong and potentially costly medications, diet recommendations, and therapies. While medical therapy offers temporary relief, THR is a one-time journey that culminates in the restoration of normal joint function. Imagine freeing our patients from a lifetime of medications, therapies, and the potential complications that accompany them. While alternative surgical options like double or triple pelvic osteotomy, also known as DPO or TPO, and femoral head ostectomy, also known as FHO, exist, THR remains as the gold standard. Remarkably, over 90% of pets who undergo THR not only regain their former selves, but also sustain their newfound vitality, regaining normal function for the rest of their lives. Following a THR surgery, pets typically remain hospitalized for 1 to 3 days. Interestingly, many pets can start weight bearing on their new hip on the same day as the surgery and exhibit significant improvement within 2 weeks. In the postoperative phase, effective pain management and exercise restrictions are essential. Pet activities need to be closely controlled with rigorous activity restrictions during the initial 6-week recovery period. Controlled leash-based exercise can be gradually extended between 6 to 12 weeks post-surgery. Most pets are ready to return to their regular activities after approximately 12 weeks. Want to learn more? Head over to Movora.com for some great information about THR, including a detailed webinar that explains more about the procedure. Foundational knowledge for referring THR patients. This webinar is designed to provide the necessary information to refer dogs and cats for THR. A total of 1 RAISE-approved CE credit is earned for successful completion of this free course. THR technology and technique have evolved and is now considered a routine surgical procedure, the gold standard for treatment of hip dysplasia and severe osteoarthritis by experts in the field. Thank you for joining me today. For more invaluable insights and tips, follow us on social media at MyBiteCandy. Together, let's continue to elevate our standard of care and provide our patients with the best possible outcomes.
And that's it for the show.
Thank you for watching Catching Up with Vet Candy.
If you want to stay up to date with everything vet med, then follow us at MyVetCandy.